Welcome back to the Tripping Off podcast. Quick question. Have you ever sat with a trauma client, done everything right, followed the treatment plan, but something still wasn't reaching them?
Yes. Jesse and I spent our careers working with complex trauma and PTSD, and we kept hitting that same exact wall. That's what led us to hypnotherapy. It's genuinely changed the way we do therapy and the way that we work with our patients and clients.
We built trauma-focused hypnotherapy for people who want better tools for their work.
The course consists of 50 CEUs, fully self-paced, and it's certified with the Department of Health.
It's a protected title, not just another weekend certification course. And we offer group discounts if your team wants to train together. Link is in the description down below. Let's get into the episode. Welcome back to another episode of the Tripping Off podcast. I'm joined as always by Zach Dotson. You have me, Jesse Lyon, and today we have a very special guest, Dr. Chris Toole. He's the clinical director of addiction services at the Linder Center of Hope in Mason, Ohio. He's also the associate professor in the Department of Psychiatry at the University of Cincinnati College of Medicine. And when we got to hear you speak in Cincinnati and all the stuff you talk about with process addiction and the way that the subconscious sort of gets people into these habits, we knew that we had to have a longer conversation. So Dr. Toole, thanks for joining us today on the podcast.
Well, thanks. It's a pleasure to be here, and I'm excited about being able to, talk about these areas, for your listeners, and I think it's, really valuable for some of the things that people need to be aware of because, right, we have the internet, and there's a lot of kind of like the old movie, like the good, the bad, and the ugly. There's the good,
right,
bad, and the ugly of the internet, and so, a lot of folks I see really struggle with a lot of problems that were really fired by the internet. So so I'm looking forward to our conversation today.
Yeah, and maybe that's where we start, because when somebody says addiction or substance use disorder, the first thing that comes to mind, I think the one that's been most popularized is alcohol, right? Like alcohol or maybe smoking, right? Something like that, or maybe harder drugs. But when we talk about process addiction, it's very different. There's not necessarily a substance involved. And so maybe we can start there.
Yeah.
How would you define process addiction for those who are listening, kind of interested in this other side of addictive tendencies?
Well, I think it's important to keep in mind that when we talk about these areas of addiction, the brain doesn't really care what it is. Really, when it comes down to it, whether I put it in my vein, in my nose, down my throat, or see it with my eyes or do it with my hands, the same or similar neurochemical processing is happening. So this makes it really vulnerable for a lot of people because of the accessibility, things like gambling, things like porn that we have access on our phones now. We don't have to go down to the bar. We don't have to, make a drive to pick up alcohol or try to, find some weed because it's so available the way it is now. But we know it's such a problematic area that's growing more and more. And we see this co-occurring relationship many times. According to SAMHSA, which is the Substance Abuse Mental Health Services Administration, about 84% of folks that have a substance use disorder also have a co-occurring mental health issue as well. So that's the rule rather than the exception. So it's not uncommon that if I have any addiction, that I probably have some mental health underlying issues as well. Depression, anxiety, trauma, abuse, grief, abandonment, all those issues. And for many folks, a substance is a way to, help me distract, to numb, to cope, to not feel, to not think. And sometimes when we do that, we don't develop those regular skills of being able to manage and cope with disappointment or stress in our lives. We go to a substance, and for many people, that's what they do. And then there's problematic areas there with the use, as we know about the brain and the research around the addictive brain.
Yeah. Would you say there's one that you're seeing the most commonly right now? I think.
Well, it's kind of like who you talk to. For some, it may be sports betting because of the accessibility to it. And, of all addictions, drugs and alcohol, as well as behavioral addictions, of all addictions, gambling has the highest suicide rate. So we see folks, they're members of GA, Gamblers Anonymous. About half of the members have had suicidal thoughts We know that spouses of problem gamblers, not the gambler, the spouse, is more likely to commit suicide than the general population. So this is a growing area that I see, in my practice with folks coming in that have out of control gambling, in debt. The number one reason for divorce is not infidelity, it is financial. And so we see that with what it does to families and relationships and partnerships. It just really destroys that. So gambling's a big one. Sex and pornography, another big one as well. If we went back in time about 160 plus years ago, before the advent of photography, the average person might just see a handful of naked people in their lifetime. And now we can see hundreds within a few minutes, right? We don't know the long-term effect that this is having. Our brains really haven't evolved much in the last 100,000 years, but technology has. And so what that does to our brain, to our mind, that stimuli, if you will, the exposure, no pun intended, the exposure to that, and what that does in regards to the brain. And I think things like sex and pornography are much more challenging because we're not hardwired for alcohol, we're not hardwired for gambling, but we are hardwired for sex. And so that makes that particular behavior much more challenging because we're supposed to create. We are designed, to respond. So we procreate. The dopamine that's triggered is that pleasure chemical that is related to food, right? If food wasn't pleasurable, we would have died out thousands of years ago. If
Right.
sex wasn't pleasurable, we wouldn't be here today, right? But so does gambling. Gambling triggers dopamine, alcohol, cannabis, spending, gaming, shopping. So there's a lot out there that we are constantly being stimulated by and kind of chasing that dopamine.
Yeah, wow. Now you said something that's fascinating. I think you said that gambling addiction has the highest rate of suicide among any addiction. Is that true?
Yeah, I mean, and it's been true actually for several years, and it really
That's fascinating.
far exceeds any other addiction. For example, here in Ohio, we have about 14 to 15 suicides per 100,000 people,
Okay.
unfortunately. But when we compare to other states, and actually that 14 is about the national average, 14 to 15. But when we look at states like Nevada, where it's all about gambling,
Vegas, baby.
yeah, we're looking more at 21 per 100,
Wow.
right? So much more damaging. We know whenever any casino opens up, that accessibility, and now we have it on our phone, that accessibility increases rates of problem gambling. Since January 1st of 2023 here in Ohio, we've allowed sports betting, and there's been over a 50% increase in calls to the Ohio problem gambling hotline since that time.
Mm.
So we're looking at the state legislature. I'm kind of involved there with a couple of representatives of looking about how can we dial back this. How can we can't really get the genie back in the bottle, but
Yeah.
what can we do to help with that? And I think it's the accessibility. If we didn't have it on our phones, I could gamble in my bed and not even get up. In the morning, I've had patients who wake up, set their alarm to gamble on horse races in England, at 2 a.m. in the morning. It's just the accessibility. It's not that people can't
Yeah.
gamble. A lot of people gamble, and it's not a problem. You know, but for some people, it's destroying their lives, and I think that's an important piece. It's just that for many people, they don't realize it. That how much I'm chasing that loss, chasing that high, and now it's so available, on the phone. So yeah, gambling is a real concern, and I think we have our responsibility to kind of at least dial it back, so to make people less vulnerable. I mean, it becomes part of the game now, right? Right before kickoff, everyone talks about the point spread and the odds. I mean, why is that part of the game? Why,
Right.
why has that been integrated into the game? And then, I also have concerns about gaming, video games, that there are versions in, video games where they use, mystery boxes or loot
Oh yeah.
boxes.
For
And
kids.
yeah, yeah, for kids, and this is on Hot Wheels. This is in Star Wars games. I hope I don't get in trouble for mentioning things, but how they, they're designed that, in order to play the game and to really be able to enjoy the game and get the right weapon or the right skin.
Customize.
Hey, yeah, customize. I have to venture into this mystery box or loot box, and I have to pay cat or money to open that up. I don't know what I'm going to get. Maybe I get this super weapon, or maybe I get a stick. You know,
Yeah.
it's
Yeah,
really
I've got to gamble to
gambling.
play.
It's gambling at for kids. So,
Yeah.
you
Well,
know,
even my toddler, they've
what is
got this
setting?
new line of toys coming out, and they don't really sell the toys like normal anymore. They're all blind bags, is what they call them. So you
Right.
buy one, and you might get a duplicate, or you might get the one that you're looking for. It's like, when did this start? Like,
Oh,
how has this become so much? I mean, there's money in it, so it
well,
Yep.
continues.
yes, and I mean, if you talk to these, gaming companies that design the games, they'll tell you most of their revenue comes from these loot boxes.
Oh yes.
You know,
Oh
not
yes.
from the sale of the game, it's from what they get afterwards. So it just, does it have to be at least, why is it aimed at kids? Why can't we just make this at an adult level and let people decide? So,
Well,
Money.
and not only that, the I'd love to hear what you think about if this just came up on my everything for me because I was talking to somebody about this topic. There's this big app that is failing to pay, and they are going to court now because they're failing to pay for people betting on the opening and closing of the Strait of Hormuz. And you can bet on anything now with these apps.
anything.
Like, will it rain today?
Yeah, will it rain
Uh,
today? There was a story where someone betted on Trump's if he would say fake news,
yep. And
and
how many times?
yeah, and I don't know how many thousands of dollars. I mean, so that gets published, right? People see that. Well, I could do that. We kind of lose sight of the reality of things. Just like what gambling does. I'm just hitting a button on my phone, or if I go to the casino, these chips. Well, they're plastic. It's not like I'm taking money out of my wallet and handing it to a person. So we're disconnected from that,
Uh, it
and
makes it easier.
yeah.
Yeah.
So many things I bet for it. Maybe even people don't think they're even betting. I'm not going to a casino, but I'm
Yeah.
betting on how long the national anthem is going to be during the Dodgers Padres game. You know,
Saw that one. Yeah, yeah. Well, you've said two things. Kind of the thread that I've seen between sports betting or any like betting and pornography is accessibility. You've mentioned that a couple times.
yeah.
How do you think, or maybe why do you think, accessibility plays a role in this? Because you're on the side of like we need to make this less accessible. That would really help kind of solve the problem. Could you talk more to that?
Right. Well, we knew just where casinos opened up in that area, in that region, rates of problem gambling increase. So the
Yeah.
accessibility, even if it's a brick and mortar type of building, so just having the accessibility to that. Years ago, when I was a kid, we knew that Playboy, was out there, but we also knew Penthouse was a little bit more graphic. We knew Hustler was more graphic than Penthouse, and so there was this kind of exposure, no pun intended, once again, and it was out there, but it was harder to get, right? Maybe you
Yeah.
had maybe you had a friend that had a big brother that had, had some magazines, and that was about it. And then the videos kind of came in. Actually,
Hmm.
this is a sidebar, but back in the day when there was and I'm old enough to remember this, right? Back when there was a battle between Beta and VHS tapes, right?
Oh, okay.
Because they were both formats at the time, and they were battling it out at the video store, right? Well, producers of adult films re-released their videos in VHS format, and that was enough to shift the market to VHS.
Wow.
Always.
Yeah.
Wow. It
Yeah.
has that kind of pull.
Yeah, pretty amazing. And I don't know this to be a fact, but I heard a similar thing when we were having the DVD battle between
I remember
Blu-ray
that.
and then there was high definition DVD. There was two formats then, and in a similar way, Blu-ray won out. So
Wow, the undercurrent that pushes it all. Interesting.
yeah.
Yeah. What do you think it is that, yeah, I was so curious about this. Like, from your experience, since you're so much in this world, what do you think it is about a person that sort of gives them the proclivity to these things? Like, is there a central theme or something about a personality that
Yeah.
makes them more susceptible to these kind
Right.
of process addictions?
Well, I think a lot of times when people, have some addiction to whether it's a chemical or maybe a process or behavioral addiction, for a lot of people, it's a symptom. It's a symptom of something
Yeah.
underlying. And we do know this, that for many people with any addiction or substance use, there's a high percentage of trauma, about 50% at least, and some experts believe it could be as high as 80%. So if that stuff comes up and I don't want to think about that stuff or feel that stuff, I'm going to try to find whatever I can to help me self-medicate with a behavior or a drug to make me feel better, to numb out, to disconnect. So a lot of work that I do as director of addictions is actually trauma work.
Right.
I do a type of therapy called EMDR, which is very interesting, very effective, really fascinating. It stands for eye movement, desensitization, and reprocessing. It's been around since kind of the late 1980s, and it's a very effective therapy for trauma. So, but a lot of folks have trauma in their history. Um, we also bring other things. Maybe there's a family history of depression or anxiety, kind of like how maybe diabetes runs in the family, or maybe like high blood pressure runs in the family. We see the same thing with depression, anxiety, and addiction. And whenever these things maybe bubble up in my life, maybe under stress, trauma, or something's going on in my life, that predisposition that I have genetically makes me vulnerable to that, maybe alcohol or that drug. Um, and that's, no fault of the person. It's just part of my genetic makeup. Now that just affects a small percentage of people, but we see how certain things can run in a person's family history that makes them more vulnerable. Now, I could have maybe diabetes in my family, but if I'm healthy and take care of myself, maybe I never develop it, right? But let's say I have depression that runs in my family. Okay, I've got supports, I have friends, but then all of a sudden I'm involved in some trauma event, and that trauma activates some of that genetic predisposition of depression or anxiety in my family. Now I'm more vulnerable to that. So for some people, they have that. I mentioned about the trauma that some people encounter, whether it's PTSD, war, violence, abuse, witnessing something horrific, grief, loss, abandonment. I know those things.
Hmm.
And then I find very quickly that by using a substance, a drug, alcohol, or some behavior, it takes that away momentarily. But because it's unresolved, it comes back up again.
I mean, a lot of the things that you're describing are not so much like a personality type of thing. It's
Correct.
genetic predisposition,
Yeah.
and then environmental. Like, what
Environmental.
traumas have you experienced? Is that what you mean? Like, would you agree with that statement?
Yes, absolutely. I
Oh,
mean,
wow.
think about how, maybe how our belief system, the thoughts that we have, how they affect what we do, right? I mean, gosh, right? In hypnosis, right? We put
Yeah.
we give those post-hypnotic suggestions, those thoughts, so they can kind of be more in the present, that there's always something better to do than drinking. I use that one. But these beliefs that we have, that we grow up with, messages from our parents and relatives and teachers and coaches and so forth, it's how I see the world, right? And then also how I see myself, especially. But maybe some of these beliefs are not true. They're distorted. Maybe I have a belief, gosh, the only way I can relax is to drink. The only way I can be social is to drink. Well, that's not true. You can relax lots of ways, right? You can be social lots of ways. I used to be in a band here in town in Cincinnati, and some of the guys in the band thought they played better, when they were high. Well, they just thought they played better.
I bet they did.
Yeah.
I bet they thought it.
Yeah.
Everyone else is like, man, he's high again.
Right, exactly.
Be a rough set.
But here's a more dramatic example of this distorted belief.
Okay.
So when I work, with different addictions, and someone that I see that maybe has a sexual addiction, or addiction to porn, or porn, prostitutes, whatever it may be. But so like in a healthy relationship, it starts off with friendship. Then you develop trust, and then commitment, and intimacy, closeness, and then sex, right? Now, we know it doesn't always go that way, right? There's still one-night stands. There's still lots of ways to have sex out there.
Yeah.
But when we think of a healthy relationship, friendship, trust, commitment, intimacy, and closeness, and sex. But for some people, because of my distorted beliefs that I have, the way that I pursue friendship, the way I establish trust, the way I find commitment in my life is by being sexual. Sex provides the way to meet those unmet needs in my life. So those distorted beliefs that I have perpetuate the addictive cycle. So we see there's lots of things. There's this genetic piece, there's this unresolved issue piece, my distorted beliefs that can play in there. And then I may just have an inability to cope, right? Mm-hmm. Whenever something comes up, well, let's do this. If you think of a best friend, someone that you grew up with, went to school with, a best friend is there for you 24/7. A best friend is there during good times and in bad. And you can always count on your best friend when you can't count on anyone else, right? Pretty good definition of a best friend.
Yeah.
I kind of like to think that guy that would help you move on a Saturday morning, it's that guy.
That's the one.
And I buy the donuts, it's like that's going to pay. Well, that's the same relationship that the person has with their addiction.
Yeah.
It's there for me 24/7.
Yeah.
Especially this, right? It's there during good times and especially bad times. And I can always count on that drug or that alcohol or that behavioral addiction to do what it promises to do every single time.
It's consistent.
When I maybe can't count on people in my life.
Wow.
And now I have to give up my best friend, the drug, to get well. It's been there. It's been there for me when I maybe had that PTSD flashback. Maybe I drank enough alcohol to pass out, so I didn't shoot myself.
Yeah.
Now you want to take that away from me. You've got something better. How difficult that becomes, right?
Before we get back to the episode, let me ask you something.
Have you ever sat with a trauma patient, done solid clinical work, followed the treatment plan, said the exact right thing, and you still felt like you were circling the actual problem?
Zach and I lived in that frustration for years. We were licensed, experienced, and trained professionals, still running into the same limitations time and time again. Hypnotherapy was not just a gimmick for us, it was the missing piece that allowed us to target these symptoms directly and work with the subconscious processes that were driving these symptoms.
And that's why we built Trauma-Focused Hypnotherapy. It's a 50 CEU course that is fully self-paced, meant for medical professionals. It's certified with the Department of Health, and so it ties directly to your clinical license.
This is not a weekend badge. It's a protected title, allowing you to do the deeper clinical work necessary to work with those trauma clients. If you care about this field and you're passionate about the work we are doing in raising the standard of mental health care in this field, Subscribing to the course does more than just give you the skills that we're talking about. It actually supports us in continuing this work, making this podcast, and teaching other professionals so they can help people live the lives they were always meant to live. The link is in the description down below. Join us and let's build something better together. Now back to the episode.
Yeah, it really brings into focus the story that we tell ourselves. There becomes this relationship with the process or the substance, and the character that they play in my life is the best friend. And so, you're like, hey, you got to give this up. You're like, well, you want me to like kill off my best friend? I'm not going to do that.
For what?
Yeah.
So, like, what is the replacement story then? I mean, if so much of it is related to genetics and then traumatic environment, like adverse childhood experiences, ACEs, right? And then there's this relational pattern, the story that develops. What's the replacement story that has to be put in there?
Well, just as many of those factors can impact a person, so is the variation of the treatment approach. For some people, if I have that genetic predisposition, I maybe have chronic depression or a chronic bipolar that runs in my family, then a lot of times medication can be helpful. Medication help regulate my mood so it doesn't impact me as much. Kind of like I need to take it, like I need to take my insulin for diabetes every day. How's the medicine going to help me with my quality of care in my life? Unresolved issues, certainly counseling, talk therapy, trauma work. Beliefs that are distorted, a type of therapy called CBT or cognitive behavioral therapy, looking at my thoughts, looking at my actions, choosing rational thinking, responsibility, coming up with a plan, more active than just talking about feelings. Years ago, I did my doctoral internship under William Glasser, Dr. Glasser. He was the founder of reality.
Oh, wow.
And he had a very simple way of explaining kind of, psychological terms, kind of bypass the psychobabble, And so
we need that.
He talked about like a car. If you think of a car, like the four wheels of a car, and the front two wheels, one wheel is cognitive or thoughts, the other front wheel, behavior or action. And wherever they go, right, the rest of the car will follow. Yeah. In the back wheels, feelings or affect, psychology likes to come up with their own words, feelings, and then the other wheel, the body or the physiological. So let's say I have a thought, right, that I want to get healthy. I want to take care of myself. I should bring down my blood pressure. I should eat better. I have that positive thought. The action, I go to the gym. I start working out. I take better care of myself. I eliminate whatever that's causing me problems, sugar, carbs, whatever. As a result, I feel better. My body improves. So that's CBT, right?
Yeah.
Inability to cope. Here we go. Hypnosis, meditation, ways to find other ways of coping with stress, tension, anxiety. A lot of times when I do trauma work, I will augment that with hypnosis as a means to helping. First of all, a lot of times a person in trauma has had struggles with their self-esteem. So I'll use that to help promote ego strengthening, building that back up, and then helping them with, another way of regulating their anxiety, helping them manage their stress. So coming up with a way of coping, then using, like I have in the past. So, I find hypnosis very valuable, as a tool that I use a lot to help with, that regulation. And, once I get past that initial, kind of response people have about hypnosis.
Right.
Sure. This has been around, medical hypnosis has been around for hundreds of years, and so we have just forgotten how beneficial something like this can be, really helping people.
I got a question for you, because the explanation there is so good, and it followed my thought process as you were kind of talking about this. So like the first thing when we were talking about, like personality and stuff like that, I almost interrupted him and was like, I absolutely have an addictive personality. And then as you were talking, I was just like, oh man, I don't want to say that.
Yeah.
Because then you started talking about trauma, and I was just like, no, my addictive personality, I want to cope.
Right.
I want to jump into something that's so deep that I can, and I've been lucky. Like I haven't had my what I was calling addictive personality has never like really attached to something that could also attach to me.
Mm-hmm.
But I absolutely think that there's that tendency there. So when you're saying that, it's like, maybe a question is like, how do I, from that perspective that you were just explaining, how do I reframe that from, I don't want to say that I have an addictive personality anymore. Yeah. What's the trance that I can replace with that?
Well, Zach, you led me right into the next point. This is perfect.
Yeah.
So the other piece, what I've been reciting here is what I call cubis, C-U-B-I-S. So we talked about the chemical part.
Okay.
We talked about the U, the unresolved issues.
Right.
The B, those distorted beliefs. The I, the inability to cope. And the S is the stimulus response relationship, what we know about the addictive brain. And this will get right to this addiction personality piece.
Cubis. That's
so
cool.
Yeah,
Okay.
cubis. So up in the front is the prefrontal cortex, right up here. This is the rational, logical, ethical, moral part of our brain. It's the triumph of our evolutionary development, separates us from any species on the planet. Prefrontal cortex.
Right.
In the back part of the brain is the midbrain, made up of the nucleus accumbens and the ventral tegmental area. It doesn't matter what that is. But one thing that the midbrain does, it's very important, is that it reinforces behaviors that are necessary for our survival. And that's where the dopamine comes in, because dopamine reinforces those behaviors. Like I mentioned earlier, if food wasn't pleasurable, we would have died out thousands of years ago. If sex wasn't pleasurable, we wouldn't be here today. Mm-hmm. So the dopamine reinforces those behaviors. But so does gambling, so does pornography, so does drugs, so does alcohol. They also trigger dopamine too. So what does that mean? So when that dopamine is triggered by the addictive behavior and floods the brain from the midbrain and hits this prefrontal cortex, the rational, logical, ethical, moral part of our brain, it actually goes offline. It's called hypofrontality, a shutting down of the prefrontal cortex. The logical brain goes offline. A simple example of that is people who get behind the wheel and drive when they're intoxicated. The logical brain would say, I can't do this. I shouldn't do this. But that's not working.
Yeah, that's the thing that's been the most affected right now.
Right. So then what happens is then another neurochemical is released from the prefrontal cortex back to the midbrain called glutamate. Glutamate's the most abundant neurochemical in our brain, and glutamate has a lot to do with learning and memory.
Okay.
Glutamate memory chemical tells the midbrain two things about our addiction. Now, like I said earlier, the brain doesn't care what it is. It just knows that dopamine is being triggered, and therefore this must be special. The drug or the alcohol or the behavior must be special. It's giving it some importance when it actually doesn't deserve any importance. The midbrain, or the glutamate memory chemical says two things about our substance. It tells the brain, don't forget it and go out and get it. So because of the impact that drugs and alcohol and behavioral addictions have on triggering the dopamine reward chemical, shutting down our rational, logical, ethical, moral brain, releasing the memory chemical glutamate that says don't forget drugs and alcohol and go out and get drugs and alcohol, the brain now believes that drugs and alcohol and behavioral addictions equals like food survival.
Yeah.
Now, we all know logically, hey, I don't need alcohol to survive. I don't need gambling to survive. That's true. But the brain thinks we do. Yeah. And therefore it drives the cravings. It drives the urge. But how have we treated addiction in the past? We've treated it like it was a moral feeling, a lack of character, a lack of willpower. Someone had an addictive personality. Oh, they're
Right.
just a bad person. And now we know none of that is true. The science is very clear of what's happening here. But we
Wow.
continue.
And those beliefs, like those thoughts that it's a moral failing, they just weren't strong enough. They're just not applying themselves. I mean, are still
Right.
just so prevalent out there.
Yeah. It's like telling grandma, grandma, if you don't get that sugar level right, we're going to have to lock you up. Right?
Oh,
It's the
geez.
same thing, right? But we continue to moralize this disorder, right? We continue to use shame, guilt, coercion, incarceration to
Mm.
try to change the behavior, right? Um, so,
It's
Well,
not gonna work.
the
It
natural
hasn't
question.
worked.
yeah, it hasn't worked, right?
Yeah.
Over 90% of folks that are in prison today are there because of drugs and alcohol or behaviors they've done.
90%?
Oh, yeah.
That's a very large number.
Yeah. Yeah.
90% is a very large number.
Yeah.
So, I mean, the natural next question then is, if this type of coercion, this guilt, this shame, this moral failing has been the, cultural, maybe unintentional treatment method for so long, do you have a suggestion for what a more helpful or appropriate path would be?
Well, you know, you and your readers can check out what they did in Portugal. Maybe
Okay.
about 30 years ago, they decriminalized all drug use.
Hmm.
And what happened? Well, crime rate went down. Prisons had to be closed. Monies that were used for prisons were now going to vocational development, career development, you know. Um, so I don't know, if that could ever be done here, maybe in some future time, but, from far, far away in a galaxy. But, I mean, we know that it's not about a person's character many times, there may be situations of, mental health issues coexisting. We know that after a point, the addictive brain takes over, it drives
Mm.
addiction forward. Um,
That's very
so,
interesting.
education is a big part, part of
Okay.
what I do with families or with any patient or client that comes in. I kind of talk about the brain so they know it's just not about badness. It has nothing to do with their badness.
Mm.
And they just have a different view of it, a different perspective. This aha moment happens.
Yeah.
And I don't know if it was Mark Twain or Carl Jung that said something like, you know, maybe we encounter, I think this was Carl Jung, maybe we encounter a single event in our life and we're never the same from that point forward, right? So maybe this awareness, maybe somebody listening to this podcast or whatever just has a different perspective, a different view of it. And maybe that might be able to change, a little bit here, a little bit there.
I hope so. I hope so.
Yeah.
Let me ask a clarifying question briefly, because I think a lot of people hear what you say, decriminalize, and I think they might misinterpret it. The pushback that I get when talking about decriminalization is decriminalization does not mean avocation, like advocating for more drugs being everywhere. So would you say that decriminalizing is an important part to take away this moral blaming, but there also should be regulation? It should be readily available, because accessibility, you said, was a big part of the determining
Right,
factors too, right?
right. No, that's correct. Right.
Okay. Okay.
So how we have kind of criminalized the person because of this
That
disorder,
makes sense.
but certainly having things in place. I'm going to say something too that probably a lot of readers won't like, or listeners won't like. But over the last, I don't know, 10 to 15 years, I used to see that certainly medicinal benefits of cannabis, right?
Yeah.
Take off the edge and anxiety, stress, right? Just kind of chill out. But what we're seeing now, because of the high levels of THC, it's become problematic big time. I mean,
Mm,
we see people coming into our residential program that have cannabis induced psychosis.
Yeah.
yes.
You know,
Big.
like like schizophrenia, psychotic behaviors because of cannabis and high levels of THC. I'm talking like super high levels. When I was in high school years ago, maybe it was around 5%. And then every 10 years, it's gone up 10. Right now it's about 20% just from, a regular dispensary, 15 to 20%. And if I use concentrates, dabs, whatever, 80%. I mean, these are just astronomical numbers that really, especially with young people, that prefrontal cortex we talked about, that's not really fully developed until we're about 26, 27 years old.
Hmm.
So, in introducing these substances with a young brain at those levels, it can be problematic. And so, yeah, that's a real concern.
Yeah, yeah, it is. Well, this has been fascinating. It's given me a lot to think about and adjusted the way that, well, I've come to understand this story that people play out and those who are suffering with these situations. Maybe to end it on a moment of hope,
Yeah,
Dr. Toole, is there anything that you might give from your experience that really helps people get out of this? Is there something about a person that makes them more likely to have positive outcomes? Is there
yeah,
something that a concerned friend can do?
yeah. You know, Jesse, I think one thing that keeps coming back to me is how important connection is.
Mm,
Yeah.
Connection. We become more and more disconnected in our society and our culture.
really have.
And part of that was COVID. We kind of became disconnected, but with that disconnection, isolation, and then kind of how our societies become more polarized, and how that disconnect really um, becomes more and more problematic. So I think just encouraging people to reach out and just kind of do healthy connections with one another. Kind of start somewhere. We we have these devices. I have these I have these followers and these friends and these likes and all these things, but it's not true connection. It's a pseudo connection, right? And we really need to find ways of connecting more with one another. Back before she passed, um, Mother Teresa was in the States, and they asked her about which country was the poorest, which had the highest poverty level. And I forgot what year this was, but this was really insightful. She said, "Well, it's the United States because they have a poverty of loneliness. They have a poverty
I
of
feel that.
isolation." Yeah. So I think, I mean, this is something that, if we found better connection with one another, how much things would be better, whether it's substance use or mental health or depression and all these things, just how do we reconnect with one another?
That's such a poetic end to where we started.
Yeah.
If you are sitting here listening to this podcast and finding yourself answering, yes, this process in my life or this substance in my life is my best friend. It's the thing or the substance that I turn to when times get tough. I mean, if you're listening to this and that's you, then the way out is to find an actual best friend, right? To live life in community and relationship and connection. And I agree. I had no idea Mother Teresa said that, but man, I couldn't agree more. And I
Yeah.
can only think that it's gotten worse, not better.
Yeah,
Yeah.
So,
I
Dr.
agree with
Toole,
that.
thank you so much.
sure.
Any closing thoughts,
Well,
Zach, before we or Chris?
thanks again for having me, and I appreciate this opportunity to be able to share this information with your viewers.
Oh my gosh, me too.
Really
Me
appreciate you.
Look him up online, Dr. Chris Toole, Tuell. You can check out the website for the Linder Center of Hope. It's lindercenterofhope.org. I'll spell it Lindner. There's an extra N in there that I think I missed.
Very good.
But check it out. I mean, if you or somebody knows going through some difficult situations, they accept people from all over the U.S. to help them through with the same kind of treatment ideas and awareness that Dr. Chris Toole's talking about today. So it's a great resource. Thank you again for taking the time to share this. It's definitely left me introspective and emotional.
Same.
Well, thank you, Jesse. Thank you, Zach.
All right.
Thank you.
For all the followers, thank you. Until next time. Bye.